Let's take a look to number 3. This is a therapeutic communication question. So this is a topic that is really likely to come up on the NCLEX because therapeutic communication isn't just for those of us working in mental health, right? It is applied throughout every field of nursing that we work in. We need to be good communicators. We need to be good therapeutic communicators. So let's take a look at this question. So we have a client who recently experienced a significant loss. And the client states, "I'm doing fine, everything is okay." However, the nurse notices the client is frowning when they're speaking. Okay, so there's a lot going on in this heading. So what do we notice is kind of our problem here? We have something we call incongruent communication, right? Our verbal and nonverbal cues are not matching up, right? So the client is saying, "Everything's fine, I'm good," but their face is showing something else, right? They're frowning when they're saying this. We're being asked which of the following would be an appropriate response for the nurse to make. So we're trying to get to the bottom of what's happening, right? We need to solve this incongruent communication, right? We need to reconcile these incongruencies we're seeing between verbal and nonverbal cues. Okay, so before we do that, let's take a second to remind ourselves what we know about therapeutic communication. Now, therapeutic communication can be broken down into kind of 3 big areas. So we have our active listening, our open-ended questions, and our non-judgmental communication. So our active listening is going to be things that we say that just kind of show the client, like, "I hear you, I understand, I'm listening," right? So we might kind of reflect things back to them. So if they said something like, "Oh, I've been up all night," we might say like, "Oh, you didn't sleep well last night. Okay, I hear you, I understand," right? And that is a good way to show the client that they have our attention and that we're following along. And then we have our open-ended questions, because we all know we typically don't want to ask closed-ended questions. So we want to ask open-ended questions to prompt the client to give us more information. So for example, if I were to ask you, "Are you studying for your NCLEX?" What are you going to tell me? You're going to say, "Yes, I am." But that's not going to give me much information. So I might ask you, "How are you studying for your NCLEX?" And that might prompt you to say, "Well, I'm using Bootcamp and I'm reviewing my class notes and I'm doing these things," right? That's going to give me more information. And then the last thing we want to be mindful is that we don't want to be coming across as being judgmental, because nobody likes to feel judged, right? And so if the client feels like you're judging them, they're not going to want to share with you. So if I, for example, asking why questions can feel judgmental. So just in our previous example, I said, "How are you studying for your NCLEX?" And you'd say, "Oh, I'm doing this and that and whatever." But if I were to ask you, "Why are you studying for your NCLEX like that?" That feels judgy, right? You'd be like, "Ooh, I don't know. Am I doing something wrong? I feel like she thinks I'm doing something wrong," right? And so we don't want to come across as being judgmental. So we don't want to say things like, "Why are you doing that?" But we do want to say things like, "Yes, I understand," or we make neutral observations like, "You seem like you might be feeling uncomfortable," or it seems like this might be happening, or "I've noticed this," right? We want to make neutral observations. So let's go back to our question and take a look and see if we can figure out which is correct. I'm seeing a lot of 1s and a lot of 4s. Let's take a look at our first one. "I can see that you're feeling upset. Tell me more about what's bothering you." I like this. "Tell me more about what's bothering you" is a nice open-ended question, right? So we're just saying, like, "Tell me more." But there's one thing about this question I don't like. Does anybody know? And this is a tough question. This is a more advanced one. The one thing I don't like about this is we're telling them kind of how they're feeling. We're saying, I see you're feeling upset." We're kind of putting words in their mouth, right? We don't want to do that. We don't want to say, like, "I see you're angry. I see you're feeling upset. I see," we're kind of telling them how they're feeling, which we don't know that, right? We don't want to make that assumption that they're upset. We just want to get to the bottom of this incongruent communication. So I think there might be a better way to ask this. So let's take a look at our other options. Our number 2 says, "Okay, I understand. If you want to talk more about how you're feeling, I'm here for you." What do you guys think? It's nice that we're saying that, "I'm here for you." That's nice, right? But does that help us get to the bottom of what's going on? We're not asking any questions at all, are we? We're just saying, like, "Okay, that's good. I'm here for you." But that doesn't help us solve our problem of this incongruent communication. Number 3. "I'm glad to hear everything is okay. Is there anything specific you'd like to discuss today?" What do we see about this one that's not so great? We're kind of just blowing right by those nonverbal cues, aren't we? We're just like, "Okay, you said everything's fine. Anything else you want to talk about?" And this is also this is a closed-ended question, right? So if we ask that, what's their response likely going to be? If I said, "Is there anything else you want to talk about?" They're going to be like, no, there's nothing more I want to talk about. So that's not going to get us any information. So let's see number 4. I see a lot of you pick this option. Let's take a look. You mentioned everything is fine, but your facial expression seems to show otherwise. I'd like to hear more about that. I like that we're just kind of observing what we're seeing. I'm like, you're saying that it's fine, but your face doesn't seem to match. We're not saying that you look angry or you look upset or you look frustrated. We're just saying like, hey, I'm observing that these two things don't match. And then we follow it up with an open-ended question. And what you'll tend to notice with therapeutic communication is it follows a pattern, right? So typically we make an observation, we ask an open-ended question. We're like, I noticed this. Tell me more about that. Or I'm seeing this. I'd like to know more, right? So it kind of follows a specific pattern of making an observation, following it up with an open-ended question, right? So I am liking number 4. All right, let's see. Are we right? We are. Good job. Okay.